Okay, so let's go. Just to keep reinforcing this stuff. Let's plow through the bony structures one more time, just to be sure we're locked in. Yeah, let's fly through this. I don't know what we did when Aries was in here. We were just kind of piggybacking. I'd point, you say one, he says one, you say one, boom, 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 and then you're reinforcing, but you're also on the spot too. Let's just go big structures of the pelvis. So we have,
The ilium,
yep,
Pubis,
yep,
sacrum,
coccyx,
ischium,
ear.
okay, this is the,
the crest, the ischial crest, the crest of the ilium,
yeah,
iliac crest.
yeah, crest.
Gee, sorry, I didn't have no caffeine yet today.
You want some?
No, I'm good.
You hit
I'm
the-
good.
Are you sure? Okay. Okay, this guy here.
Iliac fossa.
Yep. This is the,
The anterior superior iliac spine.
The anterior, inferior iliac spine.
yep,
The ramus of the pubis.
and specifically the,
The superior ramus.
yep, and then this is the,
Pubic tubule.
yep,
The inferior ramus of the pubis.
yep,
The ramus of the ischium.
yep. You guys remember what this one is?
The obturator foramen.
Yeah, dude. Let's go. Nice. Down here.
The ischial tuberosity.
Very nice. There we go. This guy here.
The acetabulum.
Yep.
The head of the femur.
The neck, femur. The
Yep.
neck of the
That's,
femur.
that's fine.
Greater trochanter.
Lesser trochanter.
Okay, so this guy here is the,
The linea aspera.
and then this guy is the,
Pectineal line.
yep,
Pectineal.
yep, and then this guy is the,
The gluteal tuberosity.
awesome dude. Okay. Alright, then we got sick or just
No, just late night.
raspy?
Yeah, I
Late
had
night?
softball and then we went out for a couple drinks and I had to deal with a dickhead.
Oh man.
Not like that.
Oh.
And then,
And then you get the scrap. Oh, bummer. So you were getting, and just playing softball, you're probably yelling and everything. Yep.
Patella.
Yep. Okay. Here we go. So this is.
the adductor to
Oh no, I'm sorry. The surface here.
the surface.
Yeah. So we have this guy, which is in the shape of a shape of a sheet. It's the shape of a C, which is the
Condyle.
of the femoral condyle, and then this would be the. Yeah.
Okay.
Nice. Yep.
You're
Yep.
on it.
Yep. And then this guy is the.
Adductor.
Yeah. Nice. Awesome. Let's see here. We got.
Okay, so
Yep.
the medial and lateral epicondyles. Those are okay. So
Yep.
just that little.
Yeah, and we were talking about this. I just don't. The way I'm differentiating is if you look at it from that angle, it looks like a C. It's a condyle. The other one's the epicondyle.
Right.
But that's, I don't know. There's I'm sure there's a better way to think about it. But yeah, it's the lateral and medial aspect of the femur, and that ends up being the epicondyle. Yep. We got this part of the head of the shit. This guy.
That is the. What is that?
So it's this bone.
Yeah, the tibia.
Yep. And then it's a
Is it tibial tuberosity?
boom. Nice dude. Way to work through it, man. Mm-hmm.
Not the
Mhm.
That cool French word.
No.
Oh yeah. The Pez answering this.
Oui, oui. That's not right.
It's the only way I can remember.
That's it. Same here, man.
French
That's
word.
all I
Little
got.
French
too.
word.
Yep. Okay. Do we miss anything on the anterior side? I don't think so, but
I don't believe so.
Do you differentiate between the there's a symphyseal
pubic symphysis.
no there's a pubic symphysis but the symphyseal something or other in here. What's it?
Ooh, pull that up. Yeah, I
Symphyseal surface. Yeah.
and that is the
It's like right by the. Let's see here. Looks like kind of right past the tablet. It's the H. Symphyseal surface.
So it's saying it has like a little
Maybe within the acetabulum.
yeah, like I don't know what the word is. It's not like a
interesting.
Yeah.
Okay.
I don't know if that was important. It's like, I don't know. I didn't see anything like connected to
maybe
it.
maybe there's like a
It'll-
little cushion for you know
Yeah,
what I mean. So
it'll
it's just
be
not
in-
going down.
I'd be interested to see if this pops up anywhere in
Like,
any of the.
I hadn't seen. That's why I was like.
Yeah.
And also the what was it? It was up here. It's the articular surface of the sacrum. Here.
Okay.
K. Just K right there. But I also didn't see anything pop up for like.
Yeah.
here.
Yeah.
Yeah.
Okay. Yeah. That's nice. So we have the symphyseal groove. You said
Symphyseal surface.
surface
And then over
and the
here.
articular surface of.
Yeah, I think I got that right. So that's the symphyseal surface, yeah. And then
Okay.
articular, yeah. So both surfaces,
Okay.
articular surfaces. Yeah.
Okay. Cool. Yeah. Well, it'll be interesting to see like what where it pops up. What
Yeah.
if there's something that attaches there. Yeah, I mean, for the most, we're gonna miss stuff.
Yeah.
It's for the majority of this stuff. It's like where do muscles attach,
Right. Totally.
but I mean, this stuff obviously.
Because I mean, reading about when we were first reading about all that stuff, it wasn't
Like in the
talking about it,
in
yeah.
the like in the landmarking.
Yeah.
Exactly. So, but I mean, it's good to know this stuff. Like if somebody's like, "Hey, I have a chipped symphyseal surface,"
Yeah.
you'll know what that means. Well, no, seriously, and that's super important. Like somebody will go, "Yeah, they told me to diagnose me with a chipped symphyseal surface," and if you don't know what that is, I mean, you could obviously Google it, but what's that
Yeah.
gonna imply, or the implications of that? I mean, if they're doing anything hip related from a rotary or flexion, extension, abduction, adduction standpoint, that's gonna they're gonna be walking with a limp or something weird. So no, that's it's super important to understand. So yeah, awesome, man.
Yeah, the book was great.
It's
love
great.
it.
It's a
such
great
good
book, man. Yeah, it's so old. I mean, I was reading that book 14 was that 12 years ago. that was the book that we were using to study.
Well,
It's-
I mean, not much changes.
no, I know. It's just
yeah, but it's not like we're evolving right now.
no.
I like how you could how they did like a walkthrough, like the actually feeling it. Like
It's
that was
it's so awesome. Yeah, the palpations
Yeah.
and the landmarks.
Yeah.
And today it's gonna be cool. We're gonna go through this and then we'll start moving each other
Mhm.
and start feeling like we've done this already. Like start feeling what muscles are doing what, and
Mhm.
how we can test this stuff. And so we'll start getting some practical hands-on application as well. So, okay. So then we had this joint.
Yes.
Yep, exactly. We have the
Posterior, superior,
no,
Oh,
this
no,
here.
sorry.
Yeah, you got that. We'll go here.
the posterior, superior iliac spine.
Yep, and
Posterior, inferior, next.
then yep.
And then I'm missing that
I
one.
believe this is the spine
Yeah,
of the ilium
Yeah.
Yeah.
or the iliac spine.
Yeah.
Yep. And then we have. Let's see what else we have here.
greater sciatic notch.
There we go. Greater sciatic notch
I
is.
think that's right. This is the last one.
Yep. There we go.
Okay.
That's right, from last time, because this is where the obturator foramen, I believe, is wrapping around somewhere around here. We're gonna have to review those
Yeah.
again. Those are some.
I mean, it goes, it wraps around and goes into here.
Yep. Cool. Okay. Obviously lumbar spine. We'll talk about that more when we get into the spine. I think that's it for the most part. Yeah. And then we have our gluteal lines.
Yeah, we were talking about
Yep.
last time.
Okay. Sweet, man. Okay, let me pull up. We'll go through the muscles. Come on. Yeah, let's flip this thing over again. We'll start on that. Oh, you know what? We could do this. Let's do this. Instead of doing this on the skelly, let's do this on a human. The muscles and everything. So, yeah, let's take that dude off of here. And then, you guys, well, maybe I'll hop on. Yeah, I'll hop on so that you can kind of feel stuff, and then we'll start.
Want your pillow?
Here. No, it's okay, dude. I'll go to sleep, man, if I do that. Okay.
That's how I feel too.
Yeah. Okay, so that's all the bones, general muscles of the pelvis and thigh. Yeah, we'll go specific muscles. Okay, man, this is nicely organized. Okay, Mike, if you want to, or let's see, if we want to just kind of run through these. So without trying to look at, oh, actually, let's go here. If we need to refer to it, we can.
Yeah.
But let's go. What's all the most of the pelvis and thigh? Hip and thigh actions. Yeah, let's go. Let's go this route. Okay, so we have flexion. Okay, so we're talking flexion of the leg. So that's this motion here.
Yep.
Okay. So let's go. We could either read through those, or we could just start rattling off the ones that we think that we can remember that flex the leg. Either one. It's up to you guys. Whatever you want to do.
Okay, well, I mean, I kind of
Yeah,
like that route.
yeah.
It makes me think right off the bat. So rec
Cool.
fem.
Yep.
Yep. And that's the hip flexor.
Yep. And you can feel that stuff if
Yeah.
you want.
Go ahead and
There it is. And that attaches.
to the inferior iliac spine,
Yep.
and then down to the tibial.
Yep. Yeah. If you want to feel, man, you can feel. Yeah.
I did
Quad.
this a little bit yesterday.
Oh, cool. Nice.
That's nice. Yeah. That's what I need to start doing. Is
Yeah.
just lay down, babe.
Yep.
And then let's think. So then you got some other little hip flexors in there.
Yep.
That's gonna be.
Does pectineus?
Yep.
Yeah, pectineus. What the other ones around? What's that? Piriformis? Would that be one? No, that's strictly.
It's deep.
Yeah. That's
So think about what crosses the
joint.
Right,
the
okay.
anterior side of the hip.
So let's see here. Everything's
Serotor-
all the
serotoris?
adductors attached to the tibial tuberosity.
Your abductors
So that'd be-
cross in there,
So-
but they don't cross up here to the
Some of them attach higher up.
gracilis. No, that's not. That's a long
So
one. But
I'm
that's
thinking, I'm not 100%. We should check on it, but I think pectineus for sure, maybe longus and brevis.
I think brevis, longus,
I'll just put
and
it-
gristals all attached to the ischial, like the ramus of the.
Well,
Plus,
the
there's-
longest attaches to the pubic tubercle,
Yeah, that's true.
and then
And the other ones do. Yeah.
so the pectineus attaches to the superior ramus of the pubis, right? So that's and then the
Brevis is the inferior ramus.
yes. So those, depending on the position of the hip, those
Right.
could be hip flexors,
Yeah.
Um,
I'm looking right here.
and then
longus was the.
longest for
the
sure.
pubic-
That has some
tubercle.
mechanical advantage there. Yeah.
So yeah, I remember it does say here they all except the gracilis
There we go.
assist to flex the hip.
There we go.
Okay.
Nice.
So
Cool.
Magnus and
Magnus, longus,
Brevis.
brevis,
And
and
pectineus.
pectineus.
Pectineus has the best lever.
Yeah,
out of
that's
all
the
of them.
biggest. Yeah. Okay, that makes sense.
Yeah.
Okay, cool.
Sweet. And then we have the deep hip flexors in the spine. and the pelvis here.
Would that be psoas?
Yep,
Or psoas minor and
Yep.
major?
yep. And then one
Because
more.
minor's a more tilt, right?
Yep,
And then major does more of the actual
Yep.
flexion.
but they both run into. Oh, you're right. That psoas minor is more of a
'Cause
lumbar
it just attaches
flex.
right
Yeah.
up to here.
Yep.
Okay.
And then iliacus is the other one.
Okay, that was one. Okay.
Yep,
Yeah, that makes sense. That's a big.
because
one.
that runs from the. Yep.
Oh yeah. Yeah. Activation. Okay, cool.
Cool. And then maybe we could look at the other, see what else we got in there.
Just
So
tensor
we got-
fascia latex.
Yep.
Now extension.
Yep.
Now we're gonna talk about
Re-
extension.
rattle off all the flexion
Oh, I
stuff.
see it. I see it. I like that actually.
Yep.
So then we got So as major,
Good.
iliacus, the TFL,
Yep.
sartorius,
Yep.
rectus femoris.
Yep.
Then we forgot our gluteus.
Glute med.
Medius and
And
minimus. They both
minimus.
slept.
Yep. There we go.
And we got our adductors that we just talked about, longus, brevis, magnus, and pectineus.
Cool.
Nice.
Those
Sweet,
are
man.
they just assist.
Yep.
It says here.
Cool. And then let's
So
let's
we're-
just do some testing here, man. Like, feel what it feels like to move me. Like, what does one leg going into flexion feel like compared to the other? Like, this is just me being a noodle here.
So I don't see that. I'm still learning what to feel for though.
Yeah, I mean, what you're feeling for is actually more on that hand than this hand, and
Okay.
it's the way that it moves, and so you can feel. Keep going. You feel how things start generating some tension up top there.
Yeah.
It's almost like your sensory is in your hand and in your fingers,
Okay.
and this is how you start learning how to move people,
Right.
and you get really good and comfortable
Right.
moving
Feel
things
like
around. Like that feels
abduction.
pretty good there, right?
Yeah.
Go that way. That starts getting tight
Yeah, that's a
immediately,
lot tighter.
right?
Yeah.
So you can start passively feeling how people move,
Okay.
and then you start getting an idea of how that joint structure is actually
How it
moving,
should,
and
yeah,
how the
yeah.
tissue tension is
That makes sense.
being created too.
Okay. And so that's
You
basically
wanna-
what you're looking for.
Yeah, it just depends on if you're choosing
then-
to move somebody passively or actively, but yeah.
When you're so if you're checking flexion, what's like a go-to position to check them in?
This is a great position to check in, and then the thing you'd be looking for here, like what we do when we're checking comparative range of motion assessment here, is if you put your hand under the low back.
This is art.
Oh.
Yep, and it's a little lower than that even. Yeah, there you go. So if I do this right away,
Oh yeah.
then I'm like, that's not hip flexion, right? That's lumbar flexion.
Yeah.
So what you want to feel for, it's good. You feel how it
I
starts.
feel that now.
yeah.
I feel it get tight. Now you start to use your lower
Yeah,
back. when you get to a
exactly.
certain
So that
point.
would be a compensatory pattern.
Okay.
Or their end range position.
Yeah.
And then you would compare it to the other side, and you would go, okay, they start moving their lumbar spine here on this side and there on this. You're like, oh my gosh,
Okay.
that's a 20% difference in mobility there.
yeah.
So yeah, that's kind of how you'd look for that. If you want to, if you want.
Sorry, you're saying, feel
Yep.
right here.
Yep. Yeah, and so then if you wanted to, you would either have me actively do it, and then you can see how the body orchestrates it. And that's kind of where I feel like I'm starting to.
Can you go any further?
I mean, I can compensate,
I see. Yeah. Okay.
right? So, and then this
And then you
side,
totally feel where he's.
and this side, I'm done here.
Yeah.
Right.
Because if I go
Go
any
back up.
further, yeah.
Look back up. Yeah, and I feel it right there.
And then I got,
Yeah.
Right.
It's all
Yeah.
on.
Okay.
versus on this side, one more time there if you want to.
Right.
Mm.
Yeah.
Right. So,
Yeah.
so I have some mobility
A
stuff
little
going
bit of
on.
hip mobility
Yeah.
is on this side.
Yep.
Mm-hmm.
Yep.
Okay, I see that.
Cool.
That makes sense.
And then the way you can test it is if you just so you can just put your hand on the top side and push down.
Okay, so
Right.
you want to hold that.
Yeah, and then you
wanna
can
hold that
feel
flexion.
both sides there. Mike, feel that side. Mike, feel this side.
Oh, see, yeah, see
You
this
feel that
side.
difference
I
there?
feel the difference. That side's definitely stronger.
Oh, yeah. Yeah.
Yeah.
Right.
way-
I'm not changing the way I'm producing force there.
Yeah.
If you guys want to feel what it feels like too, You wanna hop on?
Yeah.
One of you guys, yeah.
Go ahead, you can go first.
And so this is how we're testing control in the body. We're going, how's your body do this thing? How's it
Yeah.
do this thing? How's it do this thing?
Oh, yep, right there.
Yep.
Yeah. On the other side. Oh yeah, I feel it. It's pretty even. Good, yeah, I feel
And
good.
then lift up.
And then lift
Ready?
up.
Go. Or are you gonna
Oh
go?
yeah, go ahead. Hold it.
And then yeah, and then back down.
Nice.
Yeah, and then what we're testing for is control,
Hold it.
not strength.
Okay, so it's like being able to like.
So can you maintain the
Okay.
position? Not how hard can you push. Lift up. Ready? Go. That's it.
Yeah,
It's
he's
good.
holding,
Lift
he's
up. Ready?
maintaining it.
Go. And that's
That's
all I'm
good.
looking for. Right
Nice.
there.
Okay.
So when I'm doing control based testing, that's as far as I'm going with that. I'm
Yeah.
not. And then if I want to start seeing what their strength production or force production looks like, once I know that they have control, then I can start yarding on them.
Okay.
But when we're looking for control, it's just yep, cool. It's like I love the way that Greg says it. The guy that created this program, he says we're looking for a twitch. Boom.
Okay.
Oh, cool. It's good. Boom. Okay, cool. You want to feel it? See what that feels like?
So you want them to like get that little twitch? That's their activation type. Is that...
It's how quickly can they respond or react to force.
Okay.
So yeah, so lift up here, ready, go. That's what I'm looking for.
Okay.
Boom, respond.
Cause yeah, I mean you have to act.
Lift.
It's that.
Yep.
For me, I'm thinking of it as like the muscle activating right away.
Yep,
So
ready, go. That feels a little less responsive.
Yeah.
Lift up, ready, go. Lift up, ready, go. A little less responsive,
kinda
maybe.
see that.
Yeah.
Ready, go. Okay. Ready, go. Mm-hmm.
You feel a little
Yeah.
bit of that?
Yeah.
And then the other thing we want to think about when we're doing testing like this, I want Mike to stay down for a second, is it's a perpendicular line of force with the test. So I'll show you what that feels like. Lift up again. Ready, go. Feel how weird that is?
Yeah.
Ready, go. So that's
Like-
no longer perpendicular. I'm compressing
you're
the
pushing towards
joint.
it. Yeah.
Right, so I'm thinking here,
Mhm.
ready, go. And there you go. It feels way different.
Yeah.
So it's we call it outside track, and it's just a little bit on the outside. Like this is go again, ready, go. That's distracting or
Yeah.
pulling.
Yeah.
This is ready, go. Kind of on that perpendicular line, ready, go. And that's
And I
compressing.
feel the difference.
very, very
Yeah.
distinctly, right?
Wow, that's weird.
Yeah. So
Huh.
it's very important that when we're doing these control tests, to be testing on the outside track,
On the outside
and
track.
on a perpendicular
On-
line of force. Yeah.
Because yeah, that totally like
You can-
affected
you
my
can-
muscle. Like
Yeah. You can absolutely skew data
Yeah.
with compressive forces or
that makes
it's a
total
trip,
sense.
man. So like
Yeah.
everything we're doing, like ready, go. That's compressive. Ready,
Yeah.
go. That's that's a whole different test right there, right?
That's crazy.
Right. So you can create weakness based on compressive forces. So,
Wow.
Yeah.
Okay.
So
then
you want to feel what that feels
Yeah.
like too.
You can totally mess
Yeah,
up.
Craig
man.
mentioned it, but I
Yeah,
want
you gotta feel it.
Yeah.
Yeah.
I'm gonna
So lift up, ready, go. So that's that perpendicular line of force. Yeah, back down, lift up. This is ready, go.
That's compressive.
That's a compressive
That's
force,
so
right?
weird,
And
yeah,
then
totally.
lift up, and then ready, go. And then this is kind of on the outside
Right.
track, and that's a distraction
right.
or traction-y, kind of distracting the femoral head out of the acetabulum and pulling on everything.
right.
And that could just skew data. So
Mhm.
this is our meat and potatoes of how we learn about what their brain and all their
Mhm.
mechanisms, their metabolic capacity, everything like that. This is how we kind of get a microscope and a magnifying glass and get under the surface there from a neural and biomechanical standpoint. So
Yeah.
yep, cool. So this is good stuff,
Yeah.
man.
Yeah, I
this
like
is
it.
this is the business right here. Yep.
This is where we really get to feel it.
Yeah.
Feel it all.
So okay, cool. So we have hip flexion. Nice.
Yeah.
And we'll be practicing that. I mean, this is the meat and potatoes
Right.
here. This is it. Yep. Hip extension. Is
Hip
that it?
extension's next. Yeah.
Okay.
All right. Hip extension. We
So-
go. What were you gonna say?
Oh, I was gonna say what muscles first. Let's go there.
Yeah. So we know that back here we got
So let's see here. So right, all the hamstrings attached to the ischial tuberosity.
Yes.
Alright, so then that should be across the joint.
Yeah.
So that should
They
all
all
the hamstrings.
all the hamstrings to the hip flexion,
Alright.
membranosus,
What's
tendinosus,
this?
bicep
Mhm.
femoris.
One. Because like short head is.
Yeah. And then we're talking the big boy right here.
Yup.
That helps with extension.
Yep.
Mhm.
And then just to go back to the hammies, so they all attach ischial tuberosity. Where does semi-membranosus attach?
That's the tendon.
Tendinosis is on top. So is it membranosus or tendinosis?
Membranosus.
Membranosus.
One of them is on. I'm just trying to remember which one goes to the peasants.
I've been-
and which one.
I've been using the first letter of like
yeah.
medial,
Medial.
and then tendinosus is the other one.
The tendon one. Yeah. but
So
they're both.
membranosus medial condyle
Oh yeah.
of the tibia,
Tibia.
and then tendinosus is the pes
Tendon.
instantary. Yep.
Okay.
That's the only way I've been able to remember it is
Nice.
membranosus
Condyle.
medial condyle.
Okay, I like that.
Yeah.
Yep.
The M's go to the medial.
Yeah.
Yup.
condyle.
Yep.
Okay. And then your bicep femoris is the whatchamacallit?
Yep.
Not the tuberosity, is it?
Nope.
No, it's the
It's the head.
the head of the fibula.
Yep. And where's that? Yep.
Right
Nice.
here.
Yep. And then it kind of runs in like a line down
Yeah.
into it. Yep.
Okay.
Cool. So those are the hammies, and
We
then
got the glute max.
yep,
Origin. Let's see. There's
lot of origins,
yeah,
right?
sacrum, begins at iliac, posterior iliac crest.
Yep.
Yeah.
And
And the IT band. Right?
That's the
That's where-
insertion.
That's
Yeah,
the
yeah.
insertion point.
there's
the,
we've got the coccyx,
yeah.
The
the
sacrum.
kind of spine of the ilium, and then spine of the sacrum, or the medial border of the sacrum,
Mhm.
Yeah.
and then the
Like you were saying, the posterior crest of the
exactly. Yep.
ilium.
Yep.
One more.
I'm trying to think right now what's extension. I'm drawing a blank.
I
I'm
think
gonna
that's
cheat.
it. It's coccyx,
Okay.
sacrum, posterior aspect.
So
of
they're
the
saying, so we're missing a couple of posterior fibers. So the posterior fibers of the adductor magnus, and then the posterior fibers of the adduct or the gluteus medius also help. But we got the rest of them.
Okay. It said also says that Maximus origin is also the sacrotuberous and the sacroiliac ligaments.
Yeah,
Where's the sacrotuberous?
it's all right here.
Just in like-
Yeah, it's just
okay.
in this zone here.
So
That's why I mean, just calling it the sacrum
Got
is
it.
an
Sacrum.
easier way.
Okay.
Yeah.
Okay. So then we've got all of our quads, our maximus, and then the posterior fibers of the adductor magnus and the gluteus medius also.
There we go.
Like gluteus medius, okay.
Okay. So
Yep.
go ahead and let's do it. I want to feel that. Oh yeah, big time. So that's your big one right there.
Yep.
Max, yeah.
And then
Hammies are kicking on.
yeah. Nice. Okay. And so this is just another one where you hold
Yeah.
type thing.
Yeah. You want to give it a try?
Sure. Why not?
Okay. And then do you want to try lifting passively too, just to see what that feels like?
Sure.
Like lifting the leg up, just kind of noodle leg.
Ugh. Got a fucking heavy leg.
Yeah, dude. Isn't it weird how it's heavier?
It's weird.
Well, this is weird, right? It's heavier lifting it this way
Yeah,
than it
Than it
is lifting it into flexion.
it is for
That's
sure.
my nervous system.
Okay.
That's not the weight of the leg.
Really?
Yeah.
'Cause I mean, yeah, obviously the leg weight
Dude.
didn't change, but that is weird. So that's just your system trying to hold it down.
That's
Is that
my.
you specifically or that general?
I mean, we obviously have less range of motion, in hip extension
Right.
than we do in hip flexion, right?
Right.
Yeah.
So at end range, it's all going to feel pretty heavy
Right.
or toned, right?
Yeah.
But my body specifically is saying, no, dude,
It
I
doesn't
don't
wanna-
really want to go into hip extension
Yeah,
right now.
Just feel it. Like when I do it here, it's like okay, and it feels awkward because it's like okay, I can't. you
Well,
almost-
lift one at a
no,
time
okay.
so you can. Yeah, I mean, when you're lifting both, you're driving me into
Right.
lumbar extension.
Right.
So that feels easier. Mike, you gotta feel this side. I'm curious to see what you feel, man.
That does almost feel a little easier,
Or this one.
compared to that one. But
This one feels tight right about there.
Yeah.
and then this one,
That one feels like it seems like I can get a little bit. Yeah.
like right there. I'm not feeling.
And that was the opposite side. Let's see. So flipped over.
Yeah.
Your
you're
right side. Yeah.
Yep.
Yes, this is the opposite side of where. Yeah, you're right.
So there's something going
reflection.
on from a positional standpoint or a neural control standpoint
Yeah.
that's creating this tension system, this
Right.
production of tension.
The right side doesn't want to do flexion, but wants to do more extension.
Yep.
Left side, yeah.
So I would start making some inferences of like, okay, if I'm thinking about a treatment plan or something going on, what's going on with maybe their pelvis,
Yeah.
their spine.
Little tilt.
Something's
Yeah.
going on there that their body's going, no, I don't want to do this like this, and okay, so maybe there's a pelvic issue or something else going on. But yeah,
Okay.
it's kind of interesting to see that.
Well, I want to feel you lift it yourself, and then hold.
Yeah, it's a great test, Mike.
Yeah.
That feels really good, man.
Don't hold. Wow, you almost kicked.
Yeah.
Yeah, see, so that was huge. You almost kicked me back with
Yep.
this leg,
Yep.
and he's totally And I mean,
And they
like you
both
said,
felt
it's
pretty
opposite.
good.
Like this one is weaker on this
Yep. Yep.
on extension
Yep.
than it is flexion.
Mm-hmm.
But no, that one like you totally
Yep.
that felt good there, but here it felt wasn't
Well,
as
Yeah, still pretty good.
dramatic.
right?
It was good,
Yeah.
but it wasn't like
Yeah.
that one really fired off,
Yep,
and this
definitely.
one.
Yeah, and we'll call that. I mean, in this MSS world, we'll say that one felt higher quality.
Higher quality.
Because it's tough when you start getting into the conversation about strength
Yeah, yeah.
strength and weakness. It gets tricky because strong compared to what, weak compared to what.
Yeah.
So we kind of like to use this quality thing because it's like, okay, the quality of that push felt better comparative to the other side, or in general, this one feels pretty high quality.
Okay.
Because when we talk about strength and weakness, we're talking really. I mean, strength is a measure of how much you can, move
Force
something.
and stuff, yeah.
Exactly.
Okay, that makes
So-
sense. That makes sense.
Like, what does strong mean?
So yeah, higher quality.
Yeah.
Okay.
So this one would have been higher quality than this one, and then in an isolated event, this in general just feels a little bit more on the low quality side than we would expect
Then
to
we would
see.
be expecting, yeah.
Yeah.
So,
Yep,
so then now we're gonna start looking, somewhere. Okay.
somewhere. Yeah.
That makes sense.
You want
totally.
to feel those, man?
Yeah. Sure. Yeah. Cool.
Cool. I
Cool.
like that. Yeah,
Sweet.
I like that.
Awesome. Okay. Does somebody else want to get a?
This
Feel.
battery's dying too.
Oh,
I don't know
shit,
what
got
you're
plugged
charging.
in.
Right there.
Somebody else want to get a feel on it?
Sure.
Just get some action here. Okay. So let's check extension. Lift up. Ready. Go. Good. Lift up. Ready. Go. Good. How those feel, Mike?
They felt good. I feel
Cool.
like everything
Yep.
did what they needed to do.
Cool.
I'm trying, Mike. Okay. Go ahead.
I'll try.
Yeah.
Mm-hmm.
Okay, ready, lift up, and go. Okay. Ready, lift up, and go.
And what I would do when you're testing,
Just stay on one side.
no, you're moving in the right way. Let him come up all the way. Then put your hand on him.
Okay.
And then go.
Yeah.
Versus this, lift up. And you're kind of meeting him,
Mhm.
and then you're blocking him.
Right.
Potentially, lift up. Ready. I mean, I can see how much more range you got there.
Mm-hmm.
Back down. So you can kind of hover up with him, lift up. I'm kind of guiding him.
Mm-hmm.
Ready, go.
Gotcha.
That's a good way to
Perfect.
do it, because then they're feeling, you're kind of showing them the direction, but
Right.
you're not hindering their movement pattern.
Right.
Yep.
Makes sense.
Cool. So you want to feel that
Yeah.
too?
That's like one of my favorite stretches though. Feels good on my back.
Just moving
Just
like that.
moving, yeah. Alright, go ahead, lift this one. Alright, ready? Hold. Okay. Lift.
Good.
Hold. So the same with
Uh-oh.
Jazz. That felt this one feels more higher quality than this one for sure. Let's do it
Okay.
one more time. Lift.